my name is Dr. Steven Offenburger. I work with Airrosti Rehab Centers, and today we're going to be talking about neck and shoulder pain, but something more specifically called upper cross syndrome. Upper cross syndrome is a set of muscular imbalances that include a weakening and lengthening of the posterior muscles in the back and a tightening and a shortening of the muscles in the front that oppose them. Although you may have never heard of upper cross syndrome, you've definitely seen it. Upper cross syndrome really looks like this. It may be mild, moderate, or extreme. But what we usually find this is in people who sit all day long, whether for work or in school. Throughout fatigue throughout the day, the head becomes forward and the shoulders roll forward. And this gives the common symptoms that we see of a sharp burning pain in the shoulder here, maybe some posterior back pain, and a decreased range of motion throughout the neck, and an overall stiffness throughout the upper body. Upper cross syndrome can cause premature arthritis and tissue breakdown. What we're going to be talking about today is one, what's going on in your body, and specifically what's going on with the connective tissue called fascia, and two, what you can do to prevent upper cross syndrome. To fully understand upper cross syndrome, we really need to understand the role that fascia plays in it. We talked earlier about having weak and lengthened muscles in the back and tight muscles through the front. But fascia, as you can see right in through here and here, it actually runs throughout your whole body and thickens in response to these repetitive motions that we do every day. As it becomes too thick through the posterior muscles right here, it starts to become very sensitive to stretch, causing a burning pain. As it becomes thickened through the front part of the neck, it decreases range of motion throughout the whole anterior shoulder. Fascia doesn't receive a lot of blood supply and is really stubborn to change, but what it does do is respond to repetitive motion. So as you sit at a desk all day and slouch, fascia responds to that and molds you into place, becoming very sensitive to stretch here in the back and thickening through the front to decrease your range of motion. This is what causes most of the pain that you have. Some things for you to know and to do at home is, for one, know where good shoulder and neck position is. When I teach this to patients, I usually explain it like this. Pretend your fingers are screwdrivers and push them into the ground so that it depresses the shoulders. Tuck the chin back and turn your arms out. And this is actually where your body really wants to be and is in good position. Every day, people sit at their desk and their posture looks like this. So the best exercise to really do, if you're thinking about fascia, is just to reverse all of those things. So if you don't have a TheraBand or something to use, you can just do this. Tuck your chin, sit up straight, your thumbs are together, and as you pull them back, try to tuck your elbows into your back pockets. This depresses the shoulders, rotate the hands out, and hold right here. If you do have a TheraBand, you can wrap it around a door handle, hold it with both hands, wrap it around a few times, and start with this position right here. Stand up straight, tuck your chin, thumbs together, and as you come back, rotate your thumbs outward and try to tuck your elbows into your back pockets. As far as stretches that you can do at home, here's one that I found that's very useful. Tucking your chin and then pretending your head's gonna go in a clock fashion and you're gonna hit every number. Just pull gently on the side of the head till you feel a slight tug on the opposite side. Hold these stretches for about 20 to 30 seconds, and don't forget to keep the chin tucked. As far as a TheraBand goes, if you have one, this is an exercise that I find useful at the desk. Just holding here, putting a good amount of tension, tucking the chin, and then extending over the TheraBand. Holding each one of these for 5 to 10 seconds and going again in a clockwise fashion. One last thing you can do with a TheraBand is activating the posterior muscles and making them stronger. So taking the TheraBand, wrapping it around the back of your head, and just pushing lightly towards the back. You'd want to repeat this 20 to 30 times and do this 2 to 3 times throughout the day. So we've talked about what's going on in the body and preventative things you can do. But if you haven't been able to prevent upper cross syndrome and are experiencing symptoms, Airrosti has a great track record of quickly resolving most musculoskeletal issues, and we'd love to help. Thanks for watching. Have a great day.